Hi everyone, we are Group 2. I'm Oliver, and we'll be joined by Kate, Demetrius, and Winza. Our presentation is on Lunit, a South Korean startup founded in 2013. Lunit is a med tech company leveraging AI for cancer diagnosis and treatment. It has developed various AI models, including two FDA-cleared AI models for healthcare. Lunit's AI software for chest X-rays and mammograms are used in over thousands of healthcare sites across over 40 countries. Lunit earlier achieved FDA clearance for two AI tools, one that analyzes mammograms for breast cancer and another that triages detections in chest X-rays. Lunit is expanding its presence in the US and the European Union. It's also developing additional AI models. And now I'll pass it on to Kate.
Oliver, thank you. So I'm going to give you a little bit more detail about the two main areas of Lunit's pipeline. So the one that Oliver really covered first was the radiology. And so that's both in terms the analysis of chest x-rays and also the analysis of mammograms. And those two technologies are the Insight CXR, which stands for chest x-ray, and Insight MMD, which stands for mammogram. And so with the chest x-ray feature, can diagnose 10 different pathologies. And then with mammograms, I mean, it's pretty well understood that it supports breast cancer screening. On the oncology side, now this is only research use only so far. It has not made its way to become FDA approved. But what they're trying to do is the immune phenotyping to detect the biomarkers of the cancer itself. And the end goal of that will be to have customized medical care recommended by AI to support, your cancer treatment in a more personalized manner. From here, I'm going to pass it off to Demetrius to talk a little bit more about AI itself.
There's always been fears with AI potentially taking jobs of different specialties. Lunit AI, and specifically, has the potential of reducing diagnostic imaging workload by 70%, and that percentage comes from MMG. 95 to 96% accuracy with screenings also kind of takes away the human error that can come with screenings and with doctors looking at whether it's CT or MRI scans. And Lunit AI also has identified 50% of missed cancers, whether it be due to human error or due to progression of cancers, tumors. Lunit has been very good at kind of looking at both interval cancers that have gone to remission, as well as cancers that have been missed due to human error. Or Susan speak with the other points.
Use AI and deep learning to augment interpreting physicians. Since AI in this context is used to enhance human expertise, the hazards associated with its usage are relatively low. Since AI in this content, this idea is that AI acts as an additional safety net for physicians rather than making autonomous decisions. Therefore, it reduces the likelihood of missing critical information without talking over the diagnosis process completely. One potential downside is over-diagnosis, which relying too heavily on AI, because models are designed to be sensitive, which means they may flag abnormalities that are not clinically significant or identify begin conditions as potentially harmful. They could lead to unnecessary follow-up tests and will lead to another problem, that is increased stress for patients. Because when AI flag something as abnormality, it can trigger a chain of events involving further diagnosis testing, consulting, or potential treatment plans. And for patients, especially those already anxious about their health, this can cause undue worry and emotional distress. So managing patients' expectations, clearly communicating the role of AI in the diagnostic process is essential to minimize this stress. So we need to strike the right balance. Physicians must critically access AI-generated findings and place them within a broader context of a patient's medical history. So by doing so, they can avoid over-reliance on AI and prevent unnecessary stress for patients, while leveraging the technology's strengths to enhance accuracy and for most of the part.